If you're looking for a simple approach to supporting heart health, today I'd like to share with you a practical meal plan that draws on decades of research and firsthand experience. After many years working alongside individuals concerned with their cardiovascular health, I've seen up close how much confusion exists around this topic. There are countless tips floating around, from drinking lemon water to taking garlic supplements. But many of these miss the mark when it comes to what really matters for your arteries. In reality, our blood vessels aren't just tubes we can clean out like kitchen pipes, and so-called miracle cleanses rarely bring the results people hope for. The truth is, the health of our arteries comes down to how our bodies respond to long-term stressors like inflammation, poor lifestyle habits, and the natural aging process. Plaque isn't just something that coats the inside of a vessel, it's actually the outcome of a very complex response in our bodies, one that involves the immune system, inflammation, and how we manage cholesterol. If we truly want to support healthy arteries as we age, the most effective approach is to understand and gently address the underlying processes. This is not about quick fixes or magic ingredients, but about regular, research-backed habits that support your body's natural mechanisms. Let's talk through what actually happens inside our arteries. Each artery is made up of several layers. The innermost, called the endothelium, acts almost like a shield, allowing for smooth blood flow as long as it's healthy. Over time, and especially under stress from things like high blood pressure, chronic inflammation, or smoking, this layer can become damaged. When that happens, small gaps develop, and some cholesterol particles, particularly LDL cholesterol, slip through and get trapped in the artery wall. This trapped cholesterol doesn't cause problems right away. Trouble starts when these particles become oxidized, which you can think of as a kind of rusting. They're affected by free radicals in our bodies. Once LDL is oxidized, the immune system leaps into action to try and clean things up. It sends in special cells that attempt to break down the oxidized cholesterol, but this process can get overwhelmed. The immune cells can become loaded with fat and transform into what are called foam cells. Over time, these foam cells form the core of plaque that accumulates in arteries. And this process isn't just happening in older adults, but can start in youth too. Now here's something many people don't realize. The body's attempt to clean up this oxidized cholesterol is actually meant to protect us. But when these foam cells get stuck, can't transport the fat out, and start dying off in place, this sets off even more inflammation. Over years, this cycle continues. The plaque expands, and blood flow gradually decreases. What many might fear most is not simply the narrowing of these vessels, but the potential for plaque to rupture suddenly. This can trigger clots that block blood flow in vital areas, leading to serious events in the heart, brain, or limbs. Importantly, it's not always the largest blockages that cause the biggest issues. Sometimes smaller, unstable plaques do the most harm. For many years, the focus has been on mechanically opening up arteries through stents or surgeries when narrowing becomes severe. And while this can relieve symptoms, it doesn't always resolve the core problem or prevent future risks. What's become clear is that beyond simply widening an artery, the key is to address the underlying biology, helping the body gently remove what it no longer needs, calm down inflammation, and restore balance to the vessel walls. Your body is equipped with a fascinating mechanism that does all this, a process sometimes called reverse cholesterol transport. Here's how it works. Your body uses a molecule called HDL, often known as good cholesterol, to collect cholesterol from tissues, including your artery walls, and carry it back to the liver for processing and removal. But for HDL to truly do its job, several other factors need to be working well, including the activation of a certain transporter protein known as ABCA1. When this part of the process isn't working, cholesterol removal slows down and plaque continues to accumulate. Scientists have found that it's possible to gently support this natural cleaning process, not through drastic interventions, but by adding specific foods and nutrients to your daily meals. These foods work together, helping your body restore the balance needed for healthy arteries. And what's most encouraging, there are studies real people, not just in the lab, showing that thoughtful dietary changes can contribute to measurable improvements in arterial health. There's another piece to the puzzle, too: calcium. Plaque that develops over many years can become hardened by calcium deposits, a process that can make arteries stiff and less flexible. This is often measured by a calcium score, and a higher score means increased risk. Supporting healthy calcium balance in the arteries is an important step in any comprehensive approach to heart health. Many people try their best, following common advice to use statins, exercise, or moderate their fat intake. These are valuable steps, but sometimes, despite these efforts, calcium buildup continues and risks remain. That's why taking a fresh, evidence-based look at daily nutrition can be so impactful. In the next segments, I'll explain step by step the practical protocol, a thoughtful, science-backed meal where each ingredient is chosen for its ability to support these core processes, encouraging nitric oxide production for vessel flexibility, activating natural cholesterol transport to help clean up plaque, calming inflammation, and protecting your arteries against unnecessary calcification or damage. Stay with me, because I'll not only break down the exact recipe, but also offer guidance on how to select quality ingredients, the best timing, and easy preparation tips you can use right away. Let's start with the foundation of this protocol: supporting the natural production of nitric oxide in your vessels. Nitric oxide is a vital molecule that helps keep your blood vessels flexible and promotes healthy blood flow. As we age, and particularly in the presence of certain health conditions or chronic inflammation, the body's ability to produce nitric oxide can decrease, leading to stiffer arteries and more challenges for the heart. Remarkably, one of the simplest and most powerful ways to encourage your body's own nitric oxide production is through specific nitrate-rich vegetables. In particular, arugula and beets have been found to be among the best natural sources. Including a generous serving, about 2 to 3 cups of raw arugula or a large beet, in your daily routine can provide a steady, natural source of nitrates, which your body then converts into nitric oxide. But there's a fascinating step in this process. After you've eaten nitrate-rich foods, your body relies on certain friendly bacteria in your mouth to help convert the nitrates into useful molecules. That means everyday habits, such as not overusing mouthwash, which can wipe out beneficial bacteria, can play a surprisingly large role in supporting the health of your arteries. Simple brushing and flossing is plenty. You don't want to interfere with the bacteria that are doing a positive job for your blood vessels. To get the most out of these nitrate-rich foods, eat your arugula or beets raw. Cooking can reduce their benefits, so using them as a fresh salad base each day is both easy and effective. Within hours of eating this way, many people notice subtle shifts: warmer hands and feet, mild improvements in stamina, or even a slight drop in blood pressure. It's a gradual, gentle change, not a dramatic transformation overnight, and that's exactly how the body prefers to heal. The next crucial element in this heart-healthy meal is extra virgin olive oil, but not just any kind. Here the focus is on olive oil that's especially high in natural plant compounds called polyphenols. These particular substances present in high-quality, cold-pressed extra virgin olive oil have shown powerful anti-inflammatory abilities. They don't just help calm irritation inside artery walls, but also support the critical removal of cholesterol from where it doesn't belong. A certain compound called Oleocanthal, found in superior olive oil, supports the activation of the ABCA1 transporter, that eject button for the cholesterol trapped inside arterial immune cells. When you choose an olive oil that's peppery and burns a little at the back of your throat, it's a sign you've found one that's rich in these healthful polyphenols. You might be surprised by the recommendation: 3 to 4 tablespoons per day. It sounds like a lot, but multiple research studies have shown that people who follow this approach often experience notably better heart outcomes, even compared to those eating low-fat diets. The Mediterranean region, where this style of eating is common, consistently demonstrates the lowest rates of heart disease among older adults. It's important not to skimp on the quality of the oil. Look for extra virgin olive oil in dark glass bottles, ideally with a harvest date and clear labeling about its origin. A good oil will taste fresh and slightly pungent. Pour it generously on your salad. Think of it as a key ingredient, supporting your arteries with every meal. Alongside these, supporting healthy calcium balance deserves special attention. Over time, excess calcium may settle into artery walls, making them less flexible. Here, vitamin K2 emerges as a tremendously helpful nutrient. Unlike the more common vitamin K1, which mostly supports blood clotting, vitamin K2, especially in its form known as MK7, helps guide calcium away from arteries and into bones where it truly belongs. Some traditional foods are especially rich in vitamin K2, particularly natto, a fermented soybean product, as well as certain aged cheeses like Gouda and Edam. If natto doesn't appeal to your taste, you can also find MK7 in supplement form or by choosing aged, hard cheeses. Regular, moderate inclusion of these foods or an appropriately dosed supplement is advised when aiming to support the flexibility and health of your arteries. Pomegranates provide another boost, and not just because they taste good. The seeds, or arils, of pomegranate contain special polyphenols that help guard LDL cholesterol from the kind of oxidation that triggers the whole plaque-building process. These polyphenols bind to LDL particles, offering a protective shield which can help interrupt the cycle before it starts. Whole pomegranate seeds, about 1 cup a day, can be added to your arugula and olive oil salad, delivering both flavor and heart-protective compounds. Let's step back and recap how these foods work together. The leafy greens and beets boost nitric oxide, keeping blood vessels relaxed and flexible. High-quality olive oil calms inflammation and helps the body process cholesterol naturally. Vitamin K2 from natto, aged cheese, or supplements guides calcium away from the arteries. Pomegranate seeds shield fats in your blood from harmful oxidation. When combined, this daily meal becomes more than just a salad. It gently, repeatedly activates the biological pathways that support vessel repair and resilience. While each food has benefits on its own, it's their synergy that makes the biggest difference. The science supporting this approach is rooted in real human studies and everyday experience, not just laboratory theory. In the next portion, I'll give you clear, step-by-step directions on how to assemble this meal, practical shopping advice, and answers to common questions, so you can include this as part of your own routine to support your heart health. Let's break down exactly how to prepare and incorporate this heart-supporting meal into your day-to-day life. First, begin with a generous base. Aim for 2 to 3 cups of fresh arugula each day. If you wish, you can add raw beets, either grated or sliced thin, for extra nitrate content and variety. Remember, raw is best for maintaining those natural compounds that support nitric oxide production. Top your greens with 1 full cup of fresh pomegranate seeds. Not only do these provide the unique polyphenols that help protect LDL cholesterol, but they also add a fresh, juicy texture and a hint of sweetness to your salad, making it more enjoyable and satisfying. For your dressing, pour on 3 to 4 tablespoons of high-quality extra virgin olive oil. Don't hold back. This is where the crucial polyphenols come from, and their positive effect has been shown when consumed in these amounts. Try different trusted brands until you find one that delivers that signature peppery finish. Now, for the next component, include either 1 serving of natto, about 50 grams, or 3 ounces of well-aged Gouda or Edam cheese. If neither are available or palatable, an MK7 supplement, 180 micrograms, taken with your meal, can provide similar benefits for guiding calcium out of your arteries and back to where it matters. The entire preparation should take no more than 10 minutes. Wash the arugula, deseed your pomegranate, or use pre-packed seeds. Drizzle generously with olive oil, toss and top with cheese, or enjoy your serving of natto on the side. Finish with a pinch of salt and pepper if desired. Chew your food well, take your time, and enjoy the flavors, not only for pleasure, but because mixing these foods with saliva is a key part of how the beneficial pathways are activated. Now, when you commit to this protocol, there are a few important points to remember. Avoid antiseptic mouthwashes. These can destroy the beneficial oral bacteria needed to maximize the effects of nitrate-rich foods. Standard dental hygiene, brushing and flossing, is ideal. The olive oil should never be skipped or substituted with lower quality oils or light versions. The critical plant compounds responsible for much of these positive effects are not present in cheaper, heavily processed alternatives. If you're not accustomed to including this quantity of olive oil or rich foods, it's understandable that you might be concerned about the fat content. However, numerous well-conducted studies of older adults show that high-quality fats, like extra virgin olive oil, when consumed as part of a balanced diet and lifestyle, do not increase health risks. In fact, they have repeatedly been associated with lower rates of cardiovascular events. This meal is intended to be part of a larger commitment to healthy, whole food eating. While it's powerful, it cannot undo the harms of a heavily processed, sugar-rich, or fast food diet on its own. For the best results, use this meal as the anchor for a heart-friendly day. Fill the rest of your plate with vegetables, fruits, unprocessed proteins, and healthy grains, and avoid excess sugars and seed oils whenever possible. Many people ask whether it's necessary to eat this meal every day or if it can be included less frequently. For those truly focused on measurable changes in arterial health, especially if you are managing your heart risks actively, making it a daily routine is highly recommended. Think of it in the same way you would approach important medication. Consistency builds the foundation for steady progress. It's understandable, too, that there might be concerns about the cost or the time required to maintain this meal. Consider, however, that prevention and maintenance, in the form of smart daily habits, are far less costly, stressful, or risky than dealing with the consequences of worsening heart disease later on. Investing in your nutrition and well-being each day can pay priceless dividends in health and independence. Some also wonder about supplements versus whole foods. While supplements like MK7 for vitamin K2 or high-quality pomegranate extracts can be helpful, especially where food sources are difficult to access, the best results are almost always seen when the bulk of your nutrition comes from unprocessed, natural foods. These deliver thousands of nutrients, fibers, and plant compounds that work together in ways science is only beginning to understand. Above all, remember that positive changes in artery health happen slowly, over many months and years. Be patient. Real progress is revealed not in days or weeks, but in steady improvements, whether that's feeling more energetic, better circulation in your hands and feet, or improved results on blood tests and medical checkups. If you'd like to monitor your heart health at home, consider working with your healthcare provider to track relevant markers. Measurements like your calcium score can tell you how much calcium is present in your arteries, and repeating this test after 18 to 24 months gives you concrete feedback about your progress. Blood work, including a detailed lipid panel and markers of inflammation, can offer more insight into how your body is responding to your new habits. In the final section, I'll address a few of the most common concerns people have about this approach and share some encouragement for those just beginning their own journey towards better heart health. It's natural to have questions, especially when you're considering making a noticeable shift in your daily nutrition. Let's take a few moments to address points that often come up for people aiming to support healthy arteries later in life. First, there's often skepticism when advice goes against long-standing beliefs, such as the low-fat approach. For many decades, mainstream guidance was to strictly limit fats of all kinds, particularly for anyone worried about heart health. But over time, the research has become clear. Eating the right kinds of fats, especially those found in extra virgin olive oil, does not raise heart risk and can in fact support good cholesterol, HDL, and promote a better balance of blood lipids. It's important to emphasize that not all fats function the same way in the body. Healthy fats, especially when part of a balanced plant-rich diet, help maintain the structure of cell membranes, reduce irritation inside blood vessels, and make it easier for the body to move cholesterol out of artery walls. That's why high-quality olive oil is a cornerstone of this meal. It's not about the calories, but the unique nutrients and the role they play. Another common concern is the practicality of this protocol. Is it really necessary every single day? I recommend aiming for consistency as much as possible. If there are occasional days when you cannot prepare this meal, that's understandable. The key is to make this style of eating your default, so the benefits accumulate over time. Think of it as investing a small amount of effort each day for long-term peace of mind and well-being. Regarding the cost, while certain items like high polyphenol olive oil and fresh produce can be more expensive than some processed options, the long-term value for your health is significant. It helps to buy in bulk where possible or look for sales and seasonal produce. Remember, you're not simply buying food, you're supporting your ability to stay active, independent, and vibrant. People sometimes ask about taking vitamin or antioxidant pills as a shortcut. While supplements can play a supporting role, the best evidence continues to show that whole foods bring benefits that pills alone can't match. When you eat real foods, you're getting a balance of nutrients, fibers, and antioxidants in a form that your body can use more effectively. Equally, you may wonder if standard medical advice, such as taking cholesterol-lowering medications, is still necessary. It's important to say this clearly. Nutrition never means you should suddenly stop any medications or prescribed treatments. Rather, making positive changes in your diet and lifestyle can enhance the effect of your medical care, giving your body more tools to restore balance and resilience. Always talk to your healthcare provider before making changes to medication or supplements. Why do many healthcare professionals and standard guidelines focus on medication, while nutritional protocols like this one are not more widely promoted? The reality is, most doctors receive limited nutrition training, and the medical system is not always set up to prioritize prevention or lifestyle education. But as more research accumulates and more people experience improvement through daily choices, awareness is growing. The more we learn, the more we see that food truly can be a powerful ally over time. Here's what I recommend as you begin or continue this journey. Make your heart-healthy meal the heart of your midday or evening routine. It can be lunch or dinner, whichever fits your schedule best. Choose the freshest, highest quality ingredients you can find and afford. Prepare everything with care, eat slowly, and savor each bite, both for your enjoyment and for the health of your arteries. Consider regular check-ins with your healthcare provider. Ask about monitoring your progress, not just with standard cholesterol tests, but when appropriate, with calcium scoring and detailed lipid measurements. Supporting your heart health is not about strict deprivation or endless rules. It's about understanding how your body works, making choices that encourage its natural repair processes, and allowing yourself the time and consistency to see gradual, meaningful change. It's always the long game, one day at a time, one meal at a time. Thank you for joining me on this deep dive into arterial health. If you're finding these topics helpful, sharing your thoughts or experiences in the comments can spread this practical wisdom to others. Support is essential, and every small action, from preparing a salad to learning about your arteries, can add up to big improvements over time. Remember, your arteries are living, dynamic tissues. With patience, the right nutrition, and mindful habits, you give them the best chance to stay flexible, strong, and supportive of your overall well-being for many years to come. Take care of yourself, keep learning, and I'll see you in the next session with more practical insights into healthy aging.